May I direct the next question to Dr. Ankur? What would be some of the key screening tests for monitoring cardiovascular health today that are available, and how critical are these?
The way you nicely told that, everyone who has a heart disease was in our position before. So that feeling of regret, of having this heart disease, and I could have done something to prevent it, is always there in a cardiac patient. And there are screening tests available, and you can definitely, there are, as Dr. Gupta said, there are modifiable risk factors. So certain blood tests like checking your cholesterol levels, of which the LDL cholesterol, which is the bad cholesterol, if you have it beyond limits, and mind you, the reference ranges which we see in majority of the blood tests, sometimes those reference ranges might not be for you. So if you have a strong family history, or if you are a diabetic, the reference ranges change. And mind you, many of the data is from the Caucasian subset. So some people might be more vulnerable even with the normal cholesterol level. So that's a very important point to be made. Second, you can do certain tests like high sensitivity CRP. Then there is homocysteine levels. There's also diabetes to be checked for other risk factors. A regular blood pressure checkup, because these are risk factors for having cardiac disease. Now, when we come to if you have symptoms, how do you screen whether it is cardiac? So blood tests like CPK-MB or troponin I, these are cardiac markers. So once you do them, you come to know, get a fair bit of idea whether this pain which is there is cardiac or not. So there's a protocol to be followed at 0 hours and 6 hours. You see these markers, and then you see the ECG and find out and say that this might not be a cardiac pain. Similarly, as I said, ECG is like a window to the heart. So your ECG tells you a lot of information, it gives you, but it's not the test. Sometimes you have to go beyond. You can have everything normal. You can have an ECG normal, a 2D echo normal. Then too, you might be suffering with a cardiac disease, and that has to be impressed upon people. And sometimes it's just clinical judgment. Like, many times we just go on clinical judgment and say that, you might have a cardiac disease. I'm strongly suspecting, though these tests are negative. So that has to be highlighted. Now you come to something called as 2D echo. 2D echo is basically a sonography of the heart. So it tells you the state of the heart, it tells you the walls, the size of the heart, the pumping status, gives you a lot of information, because all we know about heart disease is heart attack. But leaving aside that too, there are a lot of other cardiac diseases which might be existing in the same patient. So 2D echo actually gives you it tells you the picture of the heart and what's the current status. But you might have to go beyond it, and you might have to do something called as a stress test or a stress thallium. So in that, what you do is you make the heart, you put the heart under stress and see how your ECG behaves. See whether you get those symptoms or not. Many a times when you're a diabetic, you might on a regular echo or an ECG not pick up, and you might not have symptoms also many a times, and it's picked up on a routine stress test. So these tests might help you. Some people who have knee problems might not be able to undergo a stress test because they might not be able to walk on the treadmill. So you do these tracer tests like thallium or technetium, wherein you give an injection and you check whether the blood flow to the heart is, with the radionucleotide dye, is properly going or not. Then you come to something called as a CT scan of the heart, so CT coronary. So there are two things in a CT coronary. One, it gives you the calcium score, which tells you the possibility of having cardiac disease, and also how aggressively you need to modify. And second thing is a CT angiogram, wherein it shows whether the blockage is present or not. If any of this is positive, or if you feel by your judgment that there is a possibility of heart disease, though all the tests are negative, the doctor might advise you a coronary angiogram. And a coronary angiogram is a gold standard. It's the final test which tells you that there is a blockage or not, where the blockage is, how much the blockage is. Depending on all of this, you make a plan. The same angiogram in a 40-year-old versus 80-year-old, your plan might be different. So all these tests in total help you to screen whether you have cardiac disease or not, to screen whether you have risk factors for having cardiac disease or not, and treat accordingly.
Wow, what an amazing gamut of tools that we have today. In fact, somebody wise once said that nothing in life is to be feared, it is only to be understood. And I guess when we know more about the problem and the available solutions, we are in a power position to make it better for ourselves, right? Now, you're living a normal life, you do these tests, and in some particular year, they're negative and you go on with life. But sometimes you do get caught in the net and you realize that probably you could be a prospective, a patient of CAD. Now, one of the major advantages that you covered is that the person can actually stop using blood thinners, and that's those many, tablets or medication less into the body. I think that itself is a good advantage. Shed some light on what are the most ideal patients for BRS? Who do you think can benefit from this technology?
So Divya, already the discussion has happened. I think everyone has almost covered the topic. But then I would like to say that till now we only had the metallic stent, which is there. Now we have the option of having this beautiful technology, which is there only when it's required, when you want to remove the block, and it dissolves after 2 to 3 years. So a young patient who does not want to take thinners, for lifelong. So the pill years is what we say, that pill burden goes down, or you take lesser number of medicines, and thinners need not be continued for lifelong. This technology is not for all. So if there is a lot of calcium in the block, or if there is a clot in the block, then you wouldn't go ahead and do it. Secondly, in an emergency, so this it's a device. It's more of a device rather than a stent. So it has to be put in a particular manner. So it takes time for it. You have to adequately prepare the blood, as Dr. Ratnaparki told, that you have to balloon dilate. So your balloon dilatation has to be aggressive. It takes time for you to deploy the stent. After putting the stent, also you need to post dilate, and you also need to do imaging of the arteries. So it takes time for deploying the stent. So in an emergency, you wouldn't do it. You'd put a metallic. So younger patients, in case hybrid strategy, we would use, and in cases of emergency, if there's a lot of calcium and thrombus, you wouldn't do.
I would just like you to also let us know whether this technology is available now in India, and how has your experience been with the same in terms of applying it to your patients?
So I've used BRS in quite some number of patients now, and I've had a fair bit of experience in putting this stent. And I must tell, this is like a 2.0 of absorbable stents. Like you have the Web 2.0 and the Web 3.0. This is like the BRS 2.0. And they have made this technology so well that the struts are thinner, and when it absorbs, it's not causing a clot. So my patient, the earliest patient I've done, is almost more than 2 years old, and he's coming for a follow-up and absolutely doing very well, and many of such patients I've done after that. And what is important, it's not only DCGI, which is the Indian authority to get in this, the stents and the drugs, but also it's a CE marked stent. So you have the Europeans also having, in the European markets also you have this approval. So all in all, it's a beautiful technology, especially in younger patients. We can use this.
Right, it's very heartening to know that this kind of a technology is now, accepted and applied, and even your patients are benefiting from the same. Moving on to Dr. Ankur, if you could just wrap up about what do you feel about World Heart Day? What's the message that you'd like to give?
So, if you see, the mascot is MS Dhoni for treatment Zaroori hai. And you know what? Dhoni was a great cricketer, but he was a very smart cricketer. And if you know, he used to anticipate things. So here we need to anticipate. We need to anticipate that we are at high risk for having cardiac disease. We need to screen ourselves well. So it is not only treatment zaruri hai, sahi treatment sahi waqt pe zaruri hai. So it's very important that you screen yourselves early, like Dr. Gupta said, at the age of 30, start screening yourself, seeing for the risk factors, and then treating it accordingly. So that's my message. Sahi treatment, sahi waqt pe treatment zaruri.